All right, for medical terminology, today we are looking at the muscles, the bones, and the joints. The combining words and forms. Osteo means bone. Arthro means joint. A joint is any place where two or more bones are connected or come together. Chondro means cartilage. Ortho means straightening or straight. Poro means porous or having holes. So osteopathy. If you were to look at this as a word and break this into pieces, osteo means bone, pathy means disease, so disease of bone. But remember, this also refers to the profession of osteopathy or osteopathic medicine, where people believed that they could cure diseases by manipulating bones. Osteitis, again, break it into pieces, is inflammation of bones. And malacia from before means the softening of, so we have the softening of bones. An oma is a tumor, more often benign. This would be a bone tumor. Sarcoma is referring to a malignant tumor. So this is a malignant bone tumor or malignant tumor. Fractures and breaks are the same thing. So a bone that is broken is a bone that is fractured. A complete fracture means it goes through the width or the entirety of the bone. You break the bone completely. An incomplete one means it doesn't go all the way through the bone, so it's not completely broken. A closed fracture means the ends that have been broken, the pieces that have been broken, are still lined up with each other. They have not disrupted the tissue around them or the skin. An open fracture, the ends of the bones that have been broken are dislocated and they have broken through the connective tissue and maybe even through the skin. A pathologic fracture is a fracture that happens as a result of disease weakening areas of bones. This would be found in certain types of cancer where bones were weakened. It would also be found in osteoporosis. In this picture, it shows you a number of different types of fractures. A normal bone doesn't have a fracture in it. This first case of a fracture is called a green stick or incomplete fracture. If you were to grab a stick off of a tree that was still living and it would be green, when you try to break it, it'll break easily on one side, but it won't break all the way through, and that makes this a green stick fracture. The next example we have here is the closed or complete fracture. This is simple, closed, so the ends still line up. It's complete because it's gone all the way through. Now a transverse fracture means it goes perpendicular to the length of the bone. An oblique one means it goes at an angle. The next picture you see here is the open fracture. You can see right there that the ends of the long bones that have been broken do not line up with each other anymore. That makes this a compound or open fracture. A comminuted fracture is one where the bone is broken into more than two pieces. Arthro refers to joint. So an arthroscope, remember a scope is an instrument, so this is an instrument we use to look inside a joint. The process of using that instrument to look inside a joint is called arthroscopy or arthroscopy. Easy for me to say. An arthropathy is a disease of a joint. Things like arthritis would be arthropathy. Osteoarthropathy now is a disease of both the joint and the bone. Arthroplasty, plasty being surgical repair. This is surgical repair of a joint. The joints include things like the hips, the elbows, the knees, but they also include the sutures in the skull where the bones are fused together. So if we break this word into its pieces, remember itis means inflammation, osteo means bone, chondro means cartilage, so this is inflammation of bone and cartilage. Chondralgia, algia means pain, this would be pain in the cartilage or cartilage pain. Ectomy, ectomy is a surgical removal of something or an excision. So chondrectomy would be the excision of cartilage. You're taking pieces of cartilage out. All right, plasia means development or growth, dys means bad, and chondro means cartilage. So this would be a defective development of cartilage, or something is wrong with the way the cartilage grew. Osteochondrodysplasia now just adds in bone to the cartilage. So this is defective development of bones and teeth. Dont and dent are the words that mean teeth. So dental pertains to teeth. Dentalgia, remember algia is pain, so this is pain, tooth pain. Ortho means straight. Ist means somebody who does, and dont means teeth. So this is somebody who straightens teeth. Orthodontists typically put braces in. Periodontal is referring to the area around the teeth. So the area around the teeth includes the gums. Endo means inside. So an endodontist is somebody who specializes in the teeth themselves, specifically on the inside. They would probably be doing a lot of root canal. Here you can see the teeth. The ones shaded in blue are your deciduous or baby teeth, the ones you have at first as little kids and then lose and replace them with the grown-up teeth or the permanent teeth. Those are in white. You have incisors in the front which act as scissors. They cut things. The canines or cuspids are the ones that look like teeth on a dog or a vampire, and they help rip flesh off. The premolars help mash things, as do the molars. And you get your last molar, the one the farthest in the back, usually somewhere in your late teens or early 20s, and you should be wiser at the time. This is why you have wisdom teeth. Or a DDS, Doctor of Dental Surgery. This is the person who you probably go to for most of your things. They can go directly after earning this degree into the practice of general dentistry. If they want to do a residency, they can become an endodontist, a periodontist, an orthodontist, or even a maxillofacial surgeon. Now, in other parts of the country, there is an equivalent degree, DMD, Doctor of Medical Dentistry. People from the Northeast and the East Coast will tend to get this degree instead of a DDS. Just like DO to MD, it is basically the same thing. This is an image of the spinal column. You can see that it breaks it into the 4 regions: the cervical, the thoracic, the lumbar, and then the sacrococcygeal. And you can see that there are curves that face this way. Those are the lordotic curves. And the curves that face this way, those are the kyphotic curves. Now, if the lordotic curve or kyphotic curve becomes too big, we call it a kyphosis, which is just that back curve becomes huge. You'll see this in younger, mostly males who develop something called Sherman's disease. And you will see this in postmenopausal older women who have osteoporosis and actually get what the dowager's hump is, an extreme kyphosis due to fractures of the vertebral bodies. A scoliosis is a lateral curvature of the spine. Most of you were probably checked for one of those in grade school, where the nurse drew their hands up and down your spine. And then lordosis is an exaggerated, most often lumbar curve, where you have what some people refer to as a sway back. You have that exaggerated low back curve, which is commonly seen in very, very overweight individuals and in pregnant women. The cervical region of the spine is the neck. Thoracic is the mid-back or thorax, and lumbo is the lower back or lumbar region. So we use the abbreviation cervicothoracic to discuss them. At the very base of the spine, you have what's called the sacrum, this triangular shaped bone in which the rest of the spine sits, but also it is wedged in between the two pelvic bones. And then at the very bottom, you have the coccyx, which is the tailbone, and the word we use to talk about that is the arm and shoulder. The upper arm bone is called the humerus. Notice how it is spelled. It is not spelled as the same as a funny thing. It is a very different spelling. Radio refers to the radius, which is your more lateral bone on the distal arm or the forearm, and the ulna bone. Carpal refers to the wrist bones. There are 8 little bones in your wrist called carpal bones. Acromial refers to this plateau on the top of your shoulder, which is actually named for the acromion process. And then the lower extremity, our largest bone of the lower extremity is called the femur. So the word we use to talk about it is femoral. And then in the lower leg, the tibia is the more medial of the two lower leg bones. It is what you put most of your weight on and the larger of them. The fibula, not fibia, but fibula, is the more lateral lower leg bone, which really contributes more to balance and coordination than it does to weight bearing. The calcaneus is your heel bone, and we say calcaneo to refer to that. Here's a picture of all your bones. Most of you are either in or about to take, either in or have taken Anatomy and Physiology 1. You get to learn the names of all these bones and many of the land. Muscles. There are 3 types of muscles. Skeletal muscle, which is sometimes referred to as striated. Striations are basically these little images you will see in muscle where you see alternating bands of dark and light. Skeletal muscle is the stuff that is attached to your bones that you can go work out at the gym by lifting heavy things. Visceral refers to the smooth muscle inside your inner organs and blood vessels. And cardiac refers to the muscle you find in your heart. Rhexis means rupture, so myorrhexis would be a rupture of muscle. Algia means pain, so myalgia is muscle pain. And a myofibroma, that would be a fibrous tumor of muscle. A myolipoma would be a fatty tumor found in muscle. Myopathy is any disease of muscle. Kinesio refers to movement. So bradykinesia would be something that's causing very slow movement. Kinesialgia would be pain upon movement. Doc, it only hurts when I have pain, or it only hurts when I move. Kinesiology is the study of movement. So some practice. Arthro means joint. Cranio means pelvi means pelvis. Osteo means centesis was a surgical puncture. Malacia is a softening of. Meter means to measure, or an instrument you would use to measure. Poro means. So arthrocentesis is a surgical puncture of a joint. We usually do that to draw fluid out, to either reduce pain or to see if there's something causing an infection. Craniomalacia means softening of the skull. That would be found in a condition called Paget's disease. Pelvimeter is a tool used to measure the pelvis. This is used in pregnant women to determine how safe it is to do natural childbirth. And then osteoporosis. Poro means porous or having holes. Osis means condition. And osteo means bone. So this is a condition where you have holes. An arthroscope, remember the scope is the tool we use to look. Arthro means joint, so we are using a tool to look in the joint. Otomy means to cut into, so that means we're cutting into a joint. Algia means pain, dent means tooth, so this is tooth pain. An ischiocele, the bone that you are probably sitting on right now, is called the ischium. If a piece of it were to herniate or stick out, you would have an ischiocele. An orthopedist, remember ist means someone who specializes in. Ped usually means kids, and ortho means straightening, so by its very definition this would mean someone who straightens out kids. Typically this is a person who works with bones and joints, more often than not straightening them out. Early on their main job was to work with kids with scoliosis and put braces on them so that they could walk straight. That's where the osteoarthropathy, disease of the bone and joint. Tendinitis. Itis, remember, means, it should be over here, sorry. Itis is the inflammation of something. Tendon is referring to tendons, the connective tissue that holds muscles to bones. So this is the inflammation of that tendon holding muscles to bones. Periodontal means somebody who works with the tissues around the teeth. A spondylolisthesis. Spondylo is another word for vertebrae or spinal bone. List is a word that means sliding, and isis is a condition of. So in a normal spine, all of the bones would line up in a certain way so that you'd have this natural curve. But if one of them slips forward, and now you have a setup like this, that is a spondylolisthesis. Osteomalacia and rickets. Malacia, remember, means softening, and osteo is bone. So this is bone softening. It's due to a lack of vitamin D in the diet. Vitamin D is necessary to absorb and to metabolize calcium. And if you don't have enough vitamin D in your system, you can't put enough calcium in your bones, so you get really, really soft bones. It is called osteomalacia when it happens in an adult. It is called rickets when it happens in a child. This is a picture on the left of a child with rickets, and this is a picture, an x-ray of that child. And you can see it's a child because the epiphysis of their tibia and femur have not fused yet with the rest of the bone. Osteoporosis is a condition in which you have holes in your bones. This is what the matrix of a normal bone looks like on the left and what a person with osteoporosis looks like on the right. You can see the holes are much bigger and have a lot more space, and there's a lot less calcium in there. Here's the Paget's disease that I was talking to you about, the bone softening disease that would actually soften your skull and actually soften your vertebrae and make them get wider and thicker. Sprains and strains. A sprain is when you have partially torn or damaged the ligaments which connect your bones to your bones. A strain is when you have injured or damaged the tendons and muscles. A strain will happen before a sprain will happen. So in other words, you could damage the muscles without damaging the ligaments, but you can't damage the ligaments without damaging the muscles. You can have a strain without a sprain, but you will never have a sprain without a strain. Now, when you get a sprain and strain of the cervical spine from rapid extreme hyperextension and hyperflexion, this damages all the ligaments and muscles of the neck and gives you what we call whiplash. There are little sacs of connective tissue that wrap around your tendons called bursa, and those bursa can become inflamed and cause bursitis. You guys all know the old person who can tell you the day before a storm is coming, and that is because these bursa, which have become inflamed, have a certain pressure on the inside of them that won't change as atmospheric pressure does. But right before a storm, atmospheric pressure tends to drop, which means now the pressure on the inside of their bursa is greater than the pressure on the outside of it. They swell up and cause pain. So those people really can tell you when the weather is about to change. Osteoarthritis, this is the wear and tear arthritis you find on large joints and the joints in your hands. So this on the left is a picture of a healthy knee, and on the right is a picture of osteoarthritis, where both the bone and the joint have been affected. Rheumatoid arthritis is an inflammatory process caused by an autoimmune disease that eats away at the more lateral part, or at the more ulnar parts of the hand and causes this strange but very, very common deformity in rheumatoid arthritis. And then gout is an accumulation of crystals of uric acid. Those are metabolic waste products from purine breakdown. So when the DNA of something is broken down and does not properly get disposed of, most often people who have gout need to cut back on red meat and alcohol.